So we're lucky enough to get some really amazing data in the county, and Sarah is the evaluator for the regional prevention providers as well as the initiatives. So we get up-to-date information on the overdose crisis that we're facing as well. I'm going to talk a little bit about that, but we focus here in San Diego County with the marijuana initiative on youth. We don't focus on adults, and that's because youth are a vulnerable group because of their age when it comes to the chemicals in marijuana, specifically THC. So our job is to prevent and educate before the brain is done developing. And then, you know, as an adult, you have choices here. You have alcohol licenses all over, marijuana dispensaries, but we really try to say that kids shouldn't be using until their brains are developed at 25. Really shouldn't be using at all, but to try to put it off until then. So let's talk a little bit about our current environment, because this is really the elephant in the room when we look at what's happening here with our overdoses. So as everybody is aware, the governor did declare marijuana an essential business very early on in the pandemic. And that did a number of things. So people in the beginning, before they thought it was going to be an essential business, started hoarding marijuana. And then when they found out it was going to be open, really the marijuana industry profited heavily during the pandemic. At the same time, schools and other youth activities were canceled or limited, leaving tremendous gaps in supervision. And this is having an effect not only on mental health of our kids, but on overdoses. We are set to have the highest overdoses in the county's history. We have a 35% increase in fentanyl deaths since 2021, and that number keeps rising every day, unfortunately. I got a report yesterday of another individual in Connecticut that had fentanyl in marijuana. Now, this is a trend we want to track, because that's the last thing we want to see is fentanyl in our marijuana supply, because we know how easy it is to get marijuana. The Surgeon General put out a very rare health advisory about our kids' mental health. And I would encourage everybody to look at this and look at the amount of suicide attempts among our young females. So along the same lines with overdoses, we're having a mental health crisis in this country right now. Now, whether you want to blame it on the pandemic or social media use or substance use, whatever it is, we all need to come together, because this is an enormously high increase among our female population. So I want to also talk about Juul. I know that many of you, especially Eric and John, are on the front lines trying to educate regarding vaping devices. We all knew when this started, this was really just a new way to hook kids on tobacco products. And it all came out in a congressional hearing how deceptive Juul was in some of their practices. They were actually sending people into schools to, quote, prevent Juul and vaping use, but they were in their own way teaching them how to use the devices. They were marketing heavily on social media, even though they were saying they were trying to get to older people to quit smoking traditional cigarettes. So they were sued, and the many schools are now profiting from very large lawsuits. San Diego is part of this lawsuit. The school district will get a large sum of money at some point. Arizona was recently paid $14.5 million because of Juul's deceptive practices. And I'm not sure how much the County Office of Ed is going to get here, but we will update that once we hear. So some of the data that we pulled, we've been keeping records regarding youth marijuana use since 2014, just to really, see what's happening with the trends as the policies continue to increase access here. So we looked at monitoring the future data, which is a very large national study. We looked at California Healthy Kids, or as we call it, CHICS, CHKS. SANDAG is the San Diego Association of Governments. They have some really good data regarding justice-involved youth. And then our community survey, treatment, public health. So there was no doubt that the marijuana industry benefited from being declared an essential business. They have made more money than ever before. And I can't tell you how hard it is for me to go into schools, which I do often, and try to discourage youth use of marijuana when we had it declared essential. And I keep hearing, well, it's essential. It's right up there with food, water, and my doctor. So that put me in a really precarious situation when I'm trying to keep our local San Diego kids from using this. The cannabis industry hit a record of 17.5 billion as Americans consume more marijuana than ever before. And again, as I said, this isn't the marijuana of the 80s, 90s, even 5 years ago. There are new strains of marijuana. There's new strains from hemp that are derived, such as Delta 8, THCP. These are all synthesized versions of THC that there have been no studies on. We don't know what the effects are really. When we look at monitoring the future though, and I might refer to Sarah occasionally, one of the things we noted is there were changes in survey methodologies during the pandemic. And to really look at some of the numbers for this particular period, because the methodologies, I can't say that, changed. So we always look at the data note. And again, you'll see that, data collection stopped prematurely due to COVID. And then completed surveys represented 25% of the size of the typical year. On a positive note, we haven't seen any huge increases according to monitoring the future. Now, we know before the COVID epidemic, we had the vaping and E-Valley epidemic. There's a really interesting study called the Million Puff Study, and they looked at how many times a person actually hits the vaporizer pen in a given day. I know a lot of people underestimate how many times they're actually taking a puff from the vaporizer pen. But this study said on average 132 puffs a day. Now just imagine using 86% THC in a stizzy pen 86 times a day with a developing brain. Now I say 86% because when we talk to local dispensary owners, they are very proud to say their best-selling products are way above 80% THC, and they are making tons of money right now. According to a California Healthy Kids survey, and I want to again thank my counterpart, Sarah, we did help develop this data note because we noticed tremendous differences from the year before. When considering 2020, 2021 CHICS data, please note survey methodologies were revised to allow for online or hybrid data collection. So in any case, whenever you change those types of things and you see an increase or a decrease, really important that we look now at the next coming years to see what happens with trends. We look at SANDAG numbers, and SANDAG has a unique data system because their numbers are backed up with a urine drug screen at the time. So we know that the average age of first use for a justice-involved youth is 11. That's very, very young, again, to be starting off using such a potent product. And then there's some other data that we have, and I think Erica probably shared our report with everybody. Let's see. Our community survey, which all of our regional prevention providers that cover the entire county go out and they survey the community, I think every 3 years. So 77% support a law requiring pharmacies to label medications that have drug interactions. 57% banned marijuana sales to those under 21. I think some of the items that we're working on as a prevention group are getting some much needed consumer protections around marijuana. I mean, if you look at how many consumer protections around buying aspirin and you compare that to 86% THC, there's nothing about driving warnings. There's nothing about prenatal use. There's nothing about the connection between mental health and high potency THC. And there's nothing about the over 500 drug interactions between THC and CBD and over-the-counter prescriptions. We're trying to get that implemented here. Treatment numbers, marijuana is the primary drug of choice for adolescents in San Diego County funded treatment, ages 12 to 17. For 18 to 25-year-olds, it's methamphetamine. We are seeing an increase in females admitted to San Diego County drug treatment for marijuana. Poison control numbers have increased 242% since 2011 and 75% since legalization in 2016. Now, a lot of this is due to, you can bake it into gummy bears and candies. A juvenile younger than 10 is not going to realize that there's extremely potent gummy bear or candy. And they go to the hospital for things like seizures, coma, and other things because of the high potency. And actually, in regards to this, there is a lawsuit that's pending right now because of the lack of consumer protections, specifically around gummies and edibles. And this is in regards to an individual who was a flight attendant who flew into San Diego, wound up consuming one of these very high potency gummies and unfortunately passed away. And now the family is suing Cushy Punch because they failed to let anybody know about the harmful side effects. And if anybody wants to see the full report, I left a link there. It's very interesting to see what they are suing to get approved, some of the exact consumer protections we've been talking about. There are about 37 emergency room visits a day related to marijuana for things like cannabinoid hyperemesis syndrome, psychosis, accidents, and again, putting pressure on our already overused emergency room system during the pandemic. It is interesting to know that cancer patients actually use less marijuana than the general public. I know there's perception out there that, most cancer patients can't get marijuana or they need it. Actually, they use less than the general public. Medical Examiner has reported that 39% of completed suicides under the age of 25 in our county tested positive for THC. Now, one of the reasons we're tracking this is because there is more and more evidence that shows that high THC potency or any marijuana use during adolescence can predispose young people to mental health issues, suicidal ideation. If you look at some of these statistics coming out of Colorado and Washington, it's very disturbing to see some of their suicide numbers since their implementation of legalized and commercial marijuana. We have tracked marijuana storefronts here using GIS technology. 16% of the existing 51 storefronts with a known address are within 1,000 feet of a school or a park. As many of you know, that's against the regulations. People really fought hard to keep these storefronts and their marketing away from kids at bus stops and schools. And now we are at least tracking those bad actors, so maybe they can modify or move the location out of a youth-sensitive area. We are also facing a crisis of drunk driving and drug driving, mostly related to poly drug use. During the pandemic, even though we told people to stay off the roadways, we are reaching record numbers for DUI deaths. In 2020, we set a record with 37 deaths on the roadways. And we're not the only county in the state Several others are saying that they've had the worst years as well. We are starting our drug driving campaign along with Vision Zero. As many of you know, Vision Zero focuses on pedestrian safety. Well, we will be adding the drunk and drug driving component here, and we're going to have a media event in April because we really need a cohesive campaign here in San Diego to tackle these unprecedented numbers. We did start a drug interactions project with 17 local pharmacies. We disseminated over 10,000 info cards letting people know of dangerous drug interactions. The info cards were both in English and Spanish. We've gotten some preliminary data. 36% admitted of patients to using marijuana on a regular basis. Almost 50% were aware of potential side effects. And 93% believe patients should be notified of potential serious drug interactions. We're going to continue to disseminate this information because, again, we want to tackle that number of ER visits. You know, if people are unaware that their blood thinner is interacting with CBD as Coumadin does with CBD, it may save people from going to the hospital. We're also partnering with ISAC, which is the International Association on the Science and Impact of Cannabis. They are trying to push back on this industry, which is kind of mirroring the tobacco industries of the 50s, 60s, and 70s. They have a great webinar series if you want to find out about the harms associated with marijuana. There's a lot of Googling going on and misperceptions. Well, this is a group of doctors that are non-political educating about marijuana harms. You should know how to file a complaint through the Department of Cannabis Control. If you do see illegal activity around marijuana storefronts, you think somebody is selling marijuana to minors, you can make a complaint through the Department of Cannabis Control. The DEA actually put out this really, I think, important informational sheet about how some of our youth are doing drug transactions by just using different emojis and different things. Now, you know, again, I'm a 50-year-old man, so sometimes just using my cell phone is tough. I know for many parents, once they give access to a phone, they're increasing access to substances. So I've just been trying to encourage parents to really think about what age are you going to give access to the phone? Because as soon as you give access to the phone, you're accessing pornography, gambling, depression, substances, and all of these other issues that come up once you increase phone access. So, you know, check the phones every once in a while. We have a lot of resources. I think we're going to see a media piece regarding the new report coming out in the Times of San Diego any day now. But all of our information is public. I'm in most of the schools now that they're opening up, trying to educate and inform not only staff, but kids. I try to use my own story of addiction. I'm a recovering alcoholic. I don't believe in scaring anybody straight. I believe in giving information and being able to relate my story. You know, everybody has a story to tell, and it's one of the things I enjoy. So I can't wait for everything to open up normally and to get back to my speaking engagement. So I think on that note, I'm going to stop sharing. And I didn't cough once through the whole thing. I want to let you know I had a bad cough for a while, so I didn't cough. Does anyone have any